Hello, everyone, and welcome to the Down Syndrome Center podcast. I'm your host, Dr. Kishore Velody. We are joined today by two guests from our feeding and swallowing clinic here at Children's Hospital of Pittsburgh to talk about a very common topic that we see not just in the Down Syndrome Center, but in pediatrics in general, or perhaps even in my house when my kids were little, and that is called picky eating. What am I even saying when they were little? Even as teenagers, they're picky eaters sometimes. So I'm hoping to learn as much as you guys are going to be learning today about how to address picky eating in children. And so before I get too far, I want to give our guest speakers an opportunity to introduce themselves. Since we have two, I'll just start with what's top on my screen. Anne, why don't you go ahead and introduce yourself? And then Sarah, we'll have you introduced right after that.
Hi, everybody. My name is Anne Condon Meyers, and I'm a clinical dietitian at Children's Hospital in Pittsburgh. And I do work in the Feeding and Swallowing Center. And I also do some clinical work as well on the floors.
Wonderful. Thank you, Anne, for joining us. And Sarah?
Hi, everyone. I'm Sarah Rossman. I'm an occupational therapist at Children's Hospital of Pittsburgh. I, like Anne, also work in the Feeding and Swallowing Clinic at Children's. And I also do outpatient occupational therapy services and provide those to kids over at the Child's Way Medical Daycare at the Children's Home.
Awesome. All right. Well, thank you both for taking time out of your busy schedules to join us today to record this podcast. Before I get too far into it, why don't we just start with a basic definition? How would you define picky eating? And you guys decide who wants to share first, but how would you define picky eating?
So I'll take this one. Picky eating can look like a lot of different things. Picky eating includes rejecting certain types of foods or even whole food groups needed for a well-balanced diet. A lot of times we see that picky eaters typically have about 30 foods in their diet. It could look like a kiddo having a strong preference for specific foods or certain types of foods, or having limited intake of other foods. A lot of times in toddlers, we see this specifically with meats and vegetables. You know, kids who they won't eat any vegetable whatsoever, or they'll only eat one type of meat, usually chicken nuggets. We can also see that picky eaters might have sensitivities to taste, smell, or different textures of the food, or they might even eat different foods than what their family is eating for meals. A lot of times they can eat with their family, but they're eating something different. And there's usually some reluctance to trying new foods. You know, it might take a little extra coercion of an encouragement for them to try new foods.
And I guess, is this something that's common? Like, I know I see it a lot in clinic. We were alluding to that earlier. Is this a common thing, picky eating? How common is it?
So it's estimated that about 50% of all kids experience picky eating. I've seen another statistic that said as many as 30% of typically developing kids and up to 80% of kids with developmental disabilities can experience feeding problems. So it's pretty common. And it's actually around age 2 is when we see it start. And that's a developmentally appropriate level of picky eating. We as therapists get concerned, you know, when it goes past that point, but we see it start around 2 years old, when toddlers are starting to assert more of that independence. And that often comes out with food choices because that's something that they can obviously control. It can also happen earlier in kids if they have, you know, some sort of history of feeding difficulty or difficulty transitioning between foods, but it's pretty common and part of development, but that does not necessarily mean that it is normal.
Got it. Okay. Yeah. That's really common. And specifically, as we're thinking about this podcast being directed towards families of kids with Down syndrome, that 80% number is pretty striking. And I think that's something that we definitely will address here as we go through this podcast. I guess when kids are picky, when they don't want to eat, is it harmful to the child? This is what the families often wonder. Nutritionally, is this something that they're going to have significant nutritional deficiencies from? And I guess, Anne, that might be a question that you might want to take. What do you think about that?
Right. This is a question for me. Well, research shows us that generally speaking, children who are picky eaters do tend to have a lower weight than their cohorts. But there's no research to say that that's necessarily a bad thing. So we don't know what that means. But particularly, children sometimes are missing out on particular nutrients, and they do need some help making their diet more expansive. So that's when we say it could be harmful. But I can't think of more than a handful of times where that has really gotten so severe that it's actually harming the growth of the child. But that being said, it can happen. And that's something, of course, that you always want to talk over with your PCP at your usual childcare visits.
So as we're thinking about, this age range, asserting their independence, the 2-year-old, we were talking about where it typically starts, that's usually where I say to families, at 2, they're going to win the battle at the kitchen table, and they're also going to win the battle in the toilet with toilet training. I mean, those are areas that often 2-year-olds, we think as parents, we can force them to do what we want them to do, but it can be really hard. Then I guess families also wonder, are there things that can look like picky eating and they may want to treat as if it's such, like a behavioral thought or approach to it. But are there things that can look like picky eating that actually could be a sign of something else, maybe something that needs to be addressed by a physician or a therapist or a nutritionist?
Sure, there definitely can be. So picky eating, we see a lot in kids who have sensory processing difficulties that, you think, oh, they just don't like this food. And really, they can't tolerate how mushy this container of yogurt is, or how mushy that banana is, or how chewy this piece of meat is. There might be a specific characteristic of a certain food that they just cannot tolerate and their body can't process it. And it's coming out as picky eating in terms of, I don't want to eat that. It could also be sensory processing in terms of the environment. So think about what a school cafeteria looks like. It's really noisy. There are a lot of different smells. Kids are everywhere. The lights might be, flickering or super bright. And for a kiddo who has sensory processing issues, they might not be able to eat their lunch. And it could have absolutely nothing to do with the food that's packed in their lunch. It could just be the environment. And they can't focus to eat their food because they're so overwhelmed by what's going on around them. There could also be, different oral motor strength or coordination difficulties. So this comes out often with kids who are avoiding certain textures or certain types of foods. Meats and raw vegetables are a good example because those ones tend to be harder to chew. So a kiddo who, might appear that they just don't want their vegetables, it could be that they really don't know how to manage it in their mouth, or it's too hard to chew and they fatigue really easily. And it's just, they can't chew it and they don't want to eat it, or they take one bite and then they're done. So it could be, oral motor, strength, coordination, all of those things kind of go into play, sensory processing, that it's coming out as kids who just might seem picky, but really there's an underlying issue that's making it difficult for them to eat. And that's why they're not eating those foods.
Mm-hmm. And also, this is Anne jumping in. There's also sometimes GI issues or disorders, we'll call them, that can lead to picky eating. And one of them is reflux, which is, of course, very common. Many infants are diagnosed with reflux. It doesn't mean that they're going to be a picky eater, but we do see a prevalence of picky eaters having some reflux history in their background. And we think that perhaps if the reflux was causing the infant not to feel well every time they ate, then that may begin affecting their other choices. Or as Sarah pointed out, it may make it more difficult for them to transition onto foods with more texture because they already have a negative association with feeding. That's to the extreme. And then there's something called EOE, which is also in the realm of the gastroenterologist. But if a child has EOE, and that's an allergic reaction, so to speak, in their esophagus, they tend also to be uncomfortable with feeding and swallowing, and there may be a negative association with food. So they become picky eaters. And then there's it's rare, but we do tend to see it in our clinic. Occasionally, it's usually a school-age child will have a choking incident, which has frightened them, understandably. They've choked on something hard. And due to this, they completely shut down and stop eating most foods. They may agree to drink something. But again, it's not the typical picky eating that, as Sarah pointed out, usually begins around age 2.
So many of the things that you just brought up, we do see with a higher frequency in kids with Down syndrome. I mean, we've had entire podcasts on sensory processing and reflux, and that EOE or eosinophilic esophagitis, we certainly do seem to see more frequently as well. So it is something that definitely, as a parent of a child with Down syndrome, that we would want to make sure that the caretakers, the providers are thinking about for the kids. So thank you for bringing us that list. But let's say we've looked into all those things. We're thinking that this is the more common kind of behavioral choices, independence asserting kind of picky eating situation. What would be some approaches that you might suggest for a child who's demonstrating these types of tendencies?
So first of all, I think families need to recognize that this is stressful for many families. And often the battle happens at the dinner table when everybody has finally convened from a busy day. Perhaps the child's been in daycare or with another family member or caretaker during the day, but everyone comes together at the table. And unfortunately, it's also when many children are just plain tired and not as hungry as everyone else. So first rule of thumb is try to relax. It's okay if your child doesn't eat well at one meal, or even if it's a toddler or a preschooler, it's okay if they don't eat well some days compared to other days. That is definitely normal behavior. And it's a little bit of a pet peeve of mine that we all say picky eating, because it does sound like this is something volitional. This is something that the child is consciously thinking. And if they would just do what I tell them to do, is how every parent feels, and especially grandparents sometimes, then everything would be okay. Well, it's more, think of it as the words using selective eating. They are being very selective. Remember, at age 2 and 3, they have a lot to do those years. They're going to completely learn to speak a new language. They're going to learn to control the environment around them. They have a lot going on. And some children simply choose to control the things that are easy to control. And sometimes that ends up being food. But it doesn't mean that it's volitional or, they're doing it on purpose. But as a parent, other things that you can do to help your child is, first of all, make sure that you're eating a variety of foods. It's not uncommon for a parent to say, I don't really like vegetables, but I really want my child to eat vegetables. So sometimes in clinic, we have to start by counseling the parent first, right? Also, know that if you bribe or beg or try to hiding food and other foods because you think that would be a healthier diet, none of that really works well. And even 2-year-olds sense that they're being manipulated. And that's exactly what they don't want to be, right? Because they want to be in control. So usually all of those tactics end up not working well. So what you want to do, what we always recommend, and so do the experts, is always put on your child's plate a couple of foods that you know that they do prefer. And it's okay to put a food that they do not prefer on their plate. But it's not everybody's job to comment on the food that they don't prefer. Everyone should simply ignore it and go about a peaceful meal. If the child eats it, great. If not, that's okay too, because studies have shown us that repeated exposure, watching other family members eat the same food, in the long run will usually help the child accept and learn to enjoy, right? It's not a matter of I want you to eat, but I want you to enjoy this new food that the rest of the family does. But usually a lot of talking about that just exerts excessive pressure on the child.
So Anne, would you say that the old adage of clean your plate or you can't do something after dinner, would you say that would be something that would be best avoided in these types of situations?
Absolutely. And I even take it a step further. There's a well-known nutritionist, Ellen Satter, who in the 80s became famous for some of her thoughts, division of responsibility, which we'll probably talk about in a minute. But she was a clear advocate of not only do you not have to clear your plate, but whatever is for dinner goes on your plate. So if you are serving a dessert for dinner, then the piece of dessert goes on the plate. And I was known in our neighborhood as the mom who would put the cookie next to the sandwich because everyone thought that was pretty cool. And the whole point of that is it's just another food. So again, it gets back to bribing. Children know when they're being bribed, and they're not able to use their appetites if they're asked to clear their plate, and then you can have a piece of candy or a dessert, etc. They know they're being bribed, and we're also teaching them to ignore their appetite, which of course you don't want to do that as well.
Great. Yeah, my mother is a listener to this podcast, so I just had to ask that question from my own childhood. No, I'm just saying. So no, thank you. I really do appreciate that approach, and I love the idea that picky eating, even saying that, brings with it some thought processes that perhaps selective eating does not. So I think that's a really interesting and a great concept that I'll bring forward for sure. What about for the child who is selectively eating and the family's concerned that they're not getting any vegetables or getting the nutrients that they need? What are your thoughts on nutritional supplements? Are those helpful?
Generally, no, I don't find them helpful because generally nutritional supplements are liquid. And especially for toddlers and preschoolers, their stomachs are small, their appetites are small, and they will fill up on that particular drink. And now when they come to the table, they are definitely not hungry, and they're definitely not interested in trying a new food. So unless a child has a medical condition, extremely low tone, which Sarah can talk about, or it's just not safe for them to chew and swallow at that point, then yes, of course, we would use a nutritional supplement to keep them healthy. Generally, though, I find that just a regular pediatric multivitamin with iron is warranted in some cases, especially for the children. As Sarah pointed out, it's often chewing fruits and vegetables that are fibrous. That's difficult. Chewing meats is also a challenge for many children, especially when they have small mouths and again, perhaps low tone. That does put them at risk to be low in certain nutrients. So a simple vitamin can address all that. And if you continue to be concerned, especially if you're wondering why the weight curve, as we call it, the rate at which your child is gaining weight, if that seems to be changing, then definitely that's something to discuss with your PCP, talk about it. Of course, dietitians as myself and others, we're always available to analyze a typical day or 3 days of what this child is eating and give you some more guidance on that.
And Sarah, specifically, as we're thinking about kids with Down syndrome, as Anne was just sharing about having a smaller mouth, having lower tone, these are things that we see in some of the kids that we take care of. Is there an approach or an evaluation that you would do looking at a child with Down syndrome to look into whether or not that might be contributing to their eating at this point?
So I think definitely an occupational therapy evaluation would be beneficial. We look at the whole picture of the child. So one thing to consider is positioning. Kids with lower tone might have a little bit more trouble sitting up and supporting themselves. They might not have as good trunk or head control. And being in a supported seat and making sure that I always tell families 90, 90, 90. So you want your hips, your knees, and your ankles all to be at 90 degrees, feet well supported, sitting up nice and straight. That way we don't have to focus on sitting while also focusing on eating. And instead you can just focus on eating. Especially in kids with Down syndrome, that's something that's really important to consider. And that's something as OTs that we would look at in the evaluation. And then we would also assess, those oral motor components that I was talking about earlier, whether there's a strength deficiency, any sort of sensory processing concerns. And we would take all of those different assessments and look at it holistically and see, okay, what is influential in the child's feeding difficulties right now? What can we work on? What can we change to better help these kiddos eat and be successful with it?
And as you were talking, thank you for that. And as you were talking about focusing and helping the child to focus, it just brought up another question in my mind is a lot of the times the families will say that when we're talking about or when we're doing eating time, when there's meal on the table, that they require distraction. The child requires distraction to feed. So they require an iPad or a television on or some song and dance to be done. Are there thoughts that you guys have about the use of those types of devices during eating?
Yeah. I'm glad you brought that up. We actually most of the time recommend avoiding those distractions because, again, eating is hard. It's pretty much the only thing that we do that requires every single sensory system in our body to work together to figure out how to eat and make it all work successfully. So when we are distracted and focusing instead on watching TV, especially if you've got a kiddo that might have some oral motor difficulties and they're having trouble chewing a food, it's really hard to focus on chewing a food that is hard when you're distracted. That's something that you really have to focus on. So avoiding those would be best. Plus, it tends to lead to mindless eating, and you kind of want to just eat the same things that you're used to. That goes along with introducing new foods too. I mean, if I was watching TV and someone handed me a new food, I'd be like, no, give me my popcorn. I don't want something new right now. I just want to do what I'm comfortable with. So it's influential with adding new foods to a kiddo's diet too.
Right. And I just think too, from a cultural aspect, families will often say, how can I get my kid to eat blah, blah, blah? And I say, you can't. We can help you empower your child to learn to enjoy food. That's the whole point. Sarah pointed out, yes, it's a very difficult physiological task that we do, but it's a task that in our culture is meant to be an enjoyable one. And so we try to keep that in mind with families, that the end point of all of this is for your child to enjoy a new food, not for you to trick, beg, bribe, or distract them into eating something that they weren't planning on eating.
Yeah, that's great. Great advice. So, boy, there's a lot of information that we've covered in this podcast. Are there resources where families can get more information, or maybe have some reinforcing of the discussion points that we've had today?
Yeah, I think so. Sarah and I both took a look at this, and there's a very simple video on healthychildren.org, which of course is from the American Academy of Pediatrics. And it's called Tips for Feeding Picky Eaters. It's just a 3-minute video. It is very short and very sweet. And it may be a good starting point, especially for other family members, not just the parents, but maybe for a well-meaning grandparent that has some different ideas about this that have changed. And then there's a really nice book that deals a lot with child development and nutrition all in one book. It's an older book, but it's by the author I mentioned before, Ellen Slatter. And it's called Child of Mine. And it's a classic. It definitely is on the level of a parent's understanding. It speaks to parents, but as a clinician, I've used it for many years. And then finally, there's a newer book. They were disciples of Ellen Slatter, and it's called Fearless Feeding, which I like that thought, right? Yeah. And it immediately begins by discussing with parents, what are your fears? What are you afraid of? And how can we address that? And then it moves on to what makes sense for your child. And specifically, it divides children into age groups. So you can go right to the chapter that deals with your child where they are at that age. And gives lots of wonderful tips, recipes, things to do with your child in the kitchen that can help get everybody ready for a more acceptive approach to new foods.
That's awesome. I'll definitely include links to those books and those websites in the show notes. So thank you for sharing those. Are there any things that we didn't cover in today's podcast that you guys were thinking, I want to make sure that we bring up, or do you feel like we've covered it all pretty well today?
I think the hitting point for me is exposure. Expose your kids to new foods, expose your kids to a variety of foods. We can't learn to eat a new food if we never see it. And as Anne mentioned earlier, it takes multiple exposures to be, accepting of a certain food. So as much as you can engage your kids in the kitchen and have them help with meal prep and have them be a part of, grocery shopping and serving food on the table, it's all going to be helpful with that. And with that too, don't be afraid to ask for help. If you have concerns that your kiddo's picky eating is a little bit more than just that typical developmental picky eating, talk to your pediatrician and see what avenue would be the best path to go down, because there's help available if, it's something that requires it.
Awesome.
Right. Yeah, I second what Sarah said. And again, most pediatricians and PCPs, some have more knowledge about picky eating than others. So But start the discussion there because they're the ones that know your child best. They can look at the growth chart. They can talk to you a little bit about what food groups, if your child is eliminating an entire food group, they can go a little bit further in guiding you as to what the next step is.
Fantastic. Well, thank you both again for joining me on the podcast today and sharing this really important information, I think, from a general pediatric perspective and also just from a Down syndrome perspective. I think we've really hit all of these points so well. So thank you both again for being here. For our listeners, I want to make sure you know that these podcasts, as we do them, many of them are coming from things that we hear in clinic. Many of them are coming from emails that we get from you. If you have a podcast topic in mind that you'd like us to cover in the future, just send us an email at downsyndromecenter@chp.edu. We are glad to hear from you. If there's a podcast you want us to redo with new updated material, please do reach out. We'd love to hear about that. Also, if any of you are interested or able to support the work that we do at the center, we love to have you join us and partner with us. All you have to do is go to www.givetochildrens.org/Down syndrome. And if you do that, you'll be able to give to our center, support things like this podcast. But until next time, bye-bye.